Hi, I'm Dr. Jeffrey Lyman. In this video, we'll be going through some of the products that we like to use to help patients recover from hip and knee replacement surgery. The first product is called a CPM machine, and this means continuous passive motion. This machine moves the knee and the hip without you having to do it, so you can be resting while this all happens.
I just was here to go over the continuous passive motion machine, tell you why we're using it, and show you how to set it up for at-home use. I know you have a lot of information that you take in. This is our last, like a post-op care that we're going to take care of you. So here is how this machine works. The machine will have your leg bending, and I know it's probably pretty scary right after surgery thinking you need to get in this machine, but it's actually very beneficial. Synovial fluids, natural healing fluids in our body, and our blood flow. As soon as we have surgery or hurt anything in our body, it likes to race to that area and try to heal it right away. This machine helps for the stiffness and swelling because our knee, of course, everything's going to rush there to be healed. This will keep everything flowing, and it also will keep your range of motion, and having that joint moving right after surgery is beneficial, not a hindrance. So I just want to go through real quick how we're going to do this. I want you to be able to measure it and know the machine that you're getting into. There's an on-off switch here at the bottom, and it just is a rocker switch. I want to show you that. It's right here. At that point, this remote will light up. It's going to preset for you. Flexion will be at 50 to 60. I try to use 50 degrees for all our total joints. Speed will be set at 60. Extension's going to remain at 0. We'll stay away from this delay switch, and it's just a simple on-off switch. All right, here where you're going to line up is right where the glute and the thigh meet. I jokingly call it the ba-thigh. So when you get in here, your joint right where the knee bends will line up at this joint here. This will do the footrest. This, you can go up and down. We just got to make sure that that footrest is planted firmly against the back of your foot, the bottom of your foot. These two knobs here are where we measure your joint line and calf to the foot. These are on a telescope system. So what you're going to do, you will get into the machine right where you need to be. Joints lined up, and then you can push back, and then as soon as that's lined up, you tighten these down. After you do your first fitting, you won't have to touch it again. Always making sure that foot is clasped in, okay? Sometimes after surgery, you're afraid to have that thigh go completely down to get full extension. Full extension is just as important as getting their flexion. So we don't want to have scar tissue building up below because you don't want to go back in for manipulation. So what I'm going to do, I'm going to slide this in here. And right where this wire is, we're going to put that right under here. And it doesn't have to be super tight. It's just a reminder to get that full extension, to keep that thigh down so you can get that healing benefit back. Flexion we have set at 50. Extension will be set at 0, and speed set at 60. So we're going to, and then stay away from the delay button. Every second day you're going to increase your flexion. So you hold that flex button down, and you can increase. This increases by 2 degrees at a time. So you can increase 2 degrees, and then increase another. So 4 degrees every other day. And you're going to be in here for 4 hours a day. You can break it into 1 to 2 hour intervals, whatever is going to suit you. Extension, we won't ever have to change that. It's going to be set at 0 degrees. Speed, you may change that every other day as well with your flexion. And again, you hold down that speed button and you increase it. And you can decrease it. The speed increases by 10s. The flexion increases and decreases by 2s. I'm going to go ahead and start this machine for you. Let me know if there's any pinching, pulling, or stiffness. And this is how your machine is going to run for you. It's pretty slow, steady. Okay. We run in a marathon, not a sprint, so everything's going to be pretty slow and steady. Okay, you should feel a good stretch in your quad, but we don't want any pain or anything in that knee joint. Okay? You understand those?
Yes.
All right. So if the machine is going up and you decide to stop it, it's when you go back to do it, it's going to go the opposite way. So it was increasing. When I hit the start button, you're going to see a decrease, and that's going to be okay. It's just the machine has a one-track mind, basically. It only can go up and down. So start and stop gives that direction. The best way to get in and out of this machine is when this gets all the way down to 0. Because if your leg is not ready for the flexion of 90 to 100, you may have to bend to get out of here. And for your safety and comfort, we want to make sure you're down to 0. Hit the stop button. You may put that back down. Undo. Undo. And make sure there's no cords or anything when you're getting out of this machine. The best place for this machine to be set is a flat, stable surface. So bed or a couch. If it's on a couch, make sure it's towards the back of a couch like we demonstrated here. If we're on the edge, it could be because you are strapped in. We don't want any toppling. So for safety features, flat, stable surface. No recliners, no ottomans. Those are very, very dangerous for you and for your new knee joint. So do you have any other questions for today?
Nope.
Perfect. Well, I hope your healing is very beneficial.